Good morning, everyone. This is Tim Burgers from the Home Care Alliance staff. I'm very happy to welcome you to our webinar presentation on the Massachusetts Paid Family and Medical Leave, being presented by Mary Jane Stewart from MassPay. Thank you very much for your willingness to present today. All the attendees are in listen-only mode during the presentation. At the end, we'll open it up so you can ask questions. So if you have questions along the way, just jot them down, and then we can go back to them at the end. So, Mary Jane, take it away.
Thank you. Well, hello, everyone, and thank you for having me. Who's so excited to have another law to follow in Massachusetts? We definitely have quite a few, and now a new one. So I'm stuck again, Tim. Huh. Okay, there we go. Thank you. So as Tim mentioned, I'm from MassPay. We are a HR and payroll services company, and we have been very fortunate to have a number of awards for our company. I'm very proud of. We're one of the, I think for 4 years, right, Maureen, we've been named one of the fastest growing companies in Massachusetts. The Stevie Award, which is our based on our customer service. We're very proud of our company, and we've been recognized for it, which is great. And we do have a full solution for HR services. Everything can be done within the software. I'm an HR person and have been in HR for over 30 years. This system is very user friendly and can house so many things that you would need and use from a employment and HR perspective. So we're going to be talking about the new law, but I just want to have a disclaimer. I am not an attorney, so please do not construe this as legal advice, and it is for educational purposes. So we're going to be talking about the new law, the Paid Family Medical Leave Act, and what the timeline is for that, who's eligible, who has to contribute, what the definitions are, the rates and things that you will need to contribute, posting requirements, and retaliation, which obviously you don't want to retaliate against anyone. So this was part of the Grand Bargain Bill, if you recall, that went into place or was voted in last year. And within the Grand Bargain Bill was the scheduled increase of minimum wage that will happen completely or up to $15 by 2023. So that was part of the Grand Bargain Bill, as well as this Paid Medical Leave Act, and also the phasing out of the holiday premium pay for retail employers, and also instituting an annual sales tax holiday. So that was part of the Grand Bargain Bill. But we're going to be talking about the Paid Family Medical Leave Act today. So beginning in 2021, January 1st, 2021, workers will be eligible for up to 12 weeks of paid family leave and up to 20 weeks for paid medical leave. Okay, the program will be funded by premiums paid by employers, employees, and those that are self-employed if they choose to contribute. And the contributions need to start July 1st of this year. And it will be managed by a new department. There's a new department that's being established. It's called the Department of Family and Medical Leave. So that is the governing department for this act. So the paid types of leave. Actually, can you guys see? Am I blocking? The paid leave of up to 12 weeks will be for family leave to bond with a child or the care of a family member with a serious health condition. That's up to 12 weeks. Medical leave for the employee's own serious medical condition is up to 20 weeks. If a family member is caring for a service member, that's up to 26 weeks. And the combination is no one could have more than 26 weeks in total. So if someone had taken leave for the bonding with a child, adopted child or a born child, and then later in the year, say they had their own serious health issue, they couldn't have more than 26 weeks in a year. So it could be in two sort of buckets that they're pulling from, but no more than 26 weeks in a year. We're going to talk about what that year is because it is different than FMLA. So the timeline, in January of this year, draft regulations were available. In March 29th, which is next week, there's going to be, it is next week, right? Yeah, that is next week. There are going to be regulations published for public comment and hearing, so that you can look forward to that. And then in January, or July, I should say, July 1st of 2019, final regulations will be released and employer contributions will begin. So there's more to come in July that we will learn. And in January 1st, 2021 is when most benefits will be available, but then all benefits will be available July 1 of 2021. Okay, so that's the time frame. So the regulations that, as I mentioned, are going to be published for public comment on the 29th, and they're, collecting contributions and processing benefits will be published at that time. So that should come out next week. So the final regulations are going to be announced, and employer contributions beginning, July 1st. Employers will begin paying contributions to the Department of Family and Medical Leave. That is the department that we're going to be paying into. And employers will remit contributions through payroll deductions. Large employers, and that's 25 or more employees in the state of Massachusetts, are responsible for paying a share of the medical leave contributions. And a self-employed person could also opt in if they choose to. They could contribute to it as well, begin those contributions. So as I mentioned before, most benefits will start in January of 2021. The reason that the delay is they're building up a trust, basically. The funds are being built up, and so that it is available for people to pull from. But unlike unemployment, it is not, your employer may never have anybody utilizing the benefit, and another employer may. So it's a fund, it's a total fund. So a paid medical or paid family benefits will be available for the bonding with a new child and service members related events, and paid medical leave benefits will be available for serious personal health conditions. Those will all be available on January 1 of 2021. Sounds far away, but it's not that far away. And all benefits will be available in July of 2021, and that includes the paid family leave benefits for the caring of a family member with a serious health condition. Okay, so everything will be available at that time. I love this. Just to be clear, giving birth to a great idea doesn't qualify you for a paid maternity leave. Nope, none under this law. So it applies to all, so the employers that need to be participating, it applies to all employers that have at least one person employed in Massachusetts. So, I know I have clients that have people all over the country. If they just have one person here, they have to contribute to it. So if anybody is working here, they have to contribute. So business entities also that have self-employed, more than 50% of their they're not employees, but they're 1099s. If like a construction company, they may have a lot of 1099 folks that work for them. If they have more than 50%, they need to also participate. And cities and towns and districts are exempt unless they opt in. So cities and towns don't have to contribute unless they want to. They can opt in. So who is covered for employees? Employees who work for a business or even a state or federal agency in Massachusetts. So even though the city may not contribute, the employee is still eligible to receive benefits if they have a serious health condition, so, or, the birth of a child. Independent contractors who contract with a business that has at least 50% of their population, or 50% or more, are a 1099. And individuals who have approximately 15 weeks of earnings and have earned at least $4,700 in a 12-month period before they apply for leave. That's very similar to unemployment, right? Those are sort of the criteria for unemployment. That's the same for this, but there are some differences, which we'll talk about. So if you're self-employed, you can opt to contribute, and virtually all employees are eligible regardless of their status or length of employment. So you could have somebody that is employed with you for 4 weeks, but before they were working for you, they worked for someone else in Massachusetts for that 15-week period, earned $4,700. They working for you for 4 weeks, and they can go out on leave. So it's definitely going to be a challenge for employers in managing, while people are out. And it does provide also payment to former employees. So if someone leaves your employment, and say they're gone 6 weeks, but their leave, they've applied for a leave, they're not working anywhere else, but they had worked for you for a year, they can apply for leave even though they're not employed right now, because it's within 26 weeks of ending employment, they can then receive benefits. The nice thing, I guess, if we want to call it a nice thing, the employer is not the one making the decision whether or not somebody receives this. It's this department. It is applying for it, and they determine whether someone is eligible, for it. But yeah, there's a lot of nuances. So the amount that someone can earn under paid family medical leave is up to $669 per week. Employees who make up to $669 per week will receive 80% of their weekly pay. And they didn't randomly come to this conclusion. The average earnings in Massachusetts right now, just average earnings per week, is $13.38 and 5 cents. That's right now what the average earnings is, and that the 669 is 50% of that. So that's how they determined that. So this is something that will likely change, because the average could go up, could go down. We've seen that in economies, so those amounts may change. But if somebody is making more than the $669 per week, they'll receive an additional amount of pay at 50% of the earnings above that $669. So, but the benefit the max they can get is $850. So I presume that could change, maybe, based on average earnings and things like that. So it will, each year they'll determine what those amounts are. Okay. So some key provisions in the law is that there is a 7-day waiting period. So the payment, before payment starts, but that time does count toward the amount of the leave, okay? Employees may use accrued time for that 7 days, but you cannot require them to. So you don't want to put in your policy that if you're out on leave, you have to use your vacation, you have to use your sick. They do not. You cannot require them to use that to cover that time. Leave is capped at 26 weeks for a single benefit year, even if it's two, events. It's capped at 26. And the leave runs concurrently with FMLA and Massachusetts parental leave, which I don't know about Massachusetts parental leave. Like, this is much richer, obviously, and the parental leave has no money associated with it, and it's 8 weeks. This is, a lot more than that. So, and there's obviously a financial. So it'll be interesting to see what happens with that, how that will whether it will stay or not. And employees need to continue to accrue benefits and receive health coverage if they're active during that leave. So if they're on your medical plan, similar to FMLA, if any of you have, had to deal with FMLA, you have to allow them to continue their benefits and work out how that's going to get paid. Same kind of thing here. You have to allow them to stay on your benefit plan. Okay. So family member under this law is much broader than under FMLA. So FMLA is very, very narrow. It's, child, spouse, what was the other? Parent? I'm blanking right now, but is that, yeah. But this is much broader. So it's spouse, domestic partner, child, parent of spouse, or domestic partner, person who stands in loco parentis when the covered individual was a minor child, grandchild, grandparent, or sibling. So that is incredibly broad. So somebody could be taking a leave for a lot of different people that they might be, responsible for. So again, something to manage by the employer. Now, a serious health condition is also much broader under this law. Illness, injury, physical or mental condition that involves inpatient care in a hospital, hospice, or residential medical facility, or continuing treatment by a healthcare provider. What does that mean? That's very broad, right? It's very broad. And the benefit year, to your question, the benefit year is a 52-week period beginning the Sunday prior to when the leave commences. So if a person goes out today is Thursday, so their leave would be Sunday. That's when their year starts ticking. March 17th, I think, was Sunday, right? So that's when it would start. So that individual would have that year. So within that year, they can't take more than 26 weeks for those two, different buckets. But that is their year. But what could happen is it's March, right? So somebody goes out on maternity leave and is out for 12 weeks. They come back, and then they are, in January, a serious medical condition. They're out again. Come March, they've used up all their time, right? They've used up all their time. They come back, and then their year, was March 17th. In May, they may go out again. So you've got somebody could be out quite a lot in the way that this is devised. So that's because in FMLA, it's a look back, right? A lot of have you done the look back period, the last 12 months? It's some people do calendar years on FMLA, but yeah, this is different. So the contribution rate split. So if you're an employer with 25 or more employees, this is how it is going to be split. So it's 0.63% of payroll, and the rate it's based on income up to 132,000. I think it's 900. which is the same amount that's used for Social Security. Like once people put in based on that amount, they no longer have to contribute. They use the same number. They use the same for this. So for 25 or more, the medical leave portion, so the employer does have to contribute 60% of the 0.52%, and the employee contributes 40%. So that's for the medical leave portion. For the family leave portion, the employer does not need to contribute anything, and the employee contributes that 0.11% of payroll. So that is for an employer of 25 or more. Now, if an employer chooses to, and I've heard people say this, I mean, maybe you're an employer that would want to, you could choose to contribute for the employee, but that isn't a requirement. But if you wanted to, you could. But this is for 25 or more. Also, for the, just to, emphasize, I guess here, but it's the medical leave portion that the employer has to contribute to, not the family leave portion. Okay. And this again is the family leave. It's the responsibility. You as the employer have to take the money out and remit it to the department, but the employee is the one that is contributing. Now, for those of you that have fewer than 25 employees, then the employer does not need to contribute at all. The employee would be the one contributing. So the employer does not have to contribute that 60% for the medical leave, but they still have to remit it to the state. So the employee would contribute to that medical leave. All right, and the family leave would still be 100% the employee contributing. Okay, I've had conversations with some of my colleagues about this. I don't know about you, but I think there will be more family leave, even though the percentage is smaller. It just seems that there may be more where people are taking care of someone than necessarily their own condition. It's just what I've seen a lot when I, worked for a very large organization, and the family medical leave that we were, working with, it was taking care of, an ailing parent. They're the only person that was responsible for that person, or a spouse. So it'll be curious to see, what it's used for, if it's mostly for people for their own or for someone else within their family. So in time will tell, I guess. So remitting of these contributions, the employers, I should say, will be filing a report with Mass Tax Connect system at the end of each calendar quarter, which is similar to unemployment, what people do now. Reporting wages and earnings for each employee, as well as any 1099 employees. Now, currently, if you have 1099 employees, you don't do this on a quarterly basis. It's done annually. So now it needs to be done quarterly. These are one of those things that we're waiting to hear. How is this supposed to, be reported? What kind of reports are we going to need to utilize? So the PFMLA will calculate the total quarterly contributions based on the report, which how that's reported yet is to come, and they'll be paid within 30 days of the end of the quarter, similar, to unemployment that's remitted, okay? If you have a private plan, some companies have short-term disability plans, right? So you may have a very generous short-term disability plan. If you do, you could apply for an exemption, but your short-term disability plan needs to be as, rich as this new law. So it can't be less than that to be able to apply for that exemption. okay? And they must be, greater or equal to the benefits of of this, but which again, these we should be learning more about applying for that beginning in April. So the exemptions will only last a year. So if you apply for an exemption and you get it, you need to apply again the following year. So it's not something that you're just grandfathered in, because you might change your plan, And exemptions may be for medical leave or family leave or both. I personally have never had a plan in an employer that also covered my family. It always was individual. Have any of you had that type of plan? Yeah. So you might get an exemption for the medical, but you'd still have to, provide for the employee would be contributing, So, and the employee covered by a private plan still needs to be protected against retaliation. And that's a big thing that we're gonna talk about as well. So posting requirements. I get a little chuckle. We were supposed to post on January 1st, but they did not give us anything yet to post. So hopefully that'll come very soon. And it needs to be posted in English or the primary language of your population, and if it's available. So if it's a language that's not available, then obviously you don't have to post it. And if you have a new employee, you will need to also provide that information to them within 30 days of hire. So just like in Massachusetts, there's that 8.5 by 11 sheet of little poster about the sick time law that is supposed to be given out upon hire. This makes sense just to put it in your new hire paperwork when we get it. And the delivery of the information is made when you have a signature of receipt. So you have to have written acknowledgement that they have received it, or a signed statement that he or she refused to sign the, it's kind of yeah. So but you have to have written acknowledgement, that where that notice of the sick law, you don't have to have a written acknowledgement, but for this you do. So retaliation. Obviously, you don't want to retaliate. So retaliation, the law prohibits retaliation against an employee who has filed a complaint of any kind, instituted or caused to be instituted a proceeding under or related to the law. So testified about an inquiry or proceeding. So if someone were called as a witness to something else that was going on, in your employ, you can't retaliate against that person for what they may have shared. Given or is about to give information connected to an inquiry, you can't retaliate. You can't retaliate against anybody for these types of things. And this is something that is pretty broad. The employer will be presumed to have retaliated if there is a negative change to an employee's seniority, their status, their employment benefits, their pay, or any other terms of employment. So, if you have someone that is someone that you have had performance issues with, and you've had conversations with them, but they were part of an investigation, and then you terminated them, even though it was based on performance, it will be assumed that you're retaliating against them if they had used any leave. So you have to be very vigilant about documenting. Document. So if there's something happening performance-wise, be sure to document it. so that you have, no, this is, or you could have, somebody could have been out on leave, and then a company has a downsizing. Well, you want to have backup as to why that person was chosen, because it may not have anything to do that they were out on leave. Maybe a department was reduced, but if you only reduce the department by a few people, you better have some documentation as to why those people were chosen versus someone else. And if you say it's because their performance was sub to someone else, you better have documentation. What's in their file so often, as an HR person, a manager, oh, I've got to get rid of so-and-so. It's like, okay, why? Well, their performance is terrible. You look at their file and their performance reviews, they look fine to me. You know what? Have you ever talked with them about that? Well, you really have to be vigilant about that. So again, if any time during a family or medical leave taken by the employee, this is again it's going to be presumed that it is retaliation if anything happens during a family or medical leave taken by an employee during a 6-month period following the leave or reinstatement, within 6 months of terminations of a proceeding in which the employee participated. So if an employee was out on leave, came back, and then 6 months from now, or within that 6-month period, adversely their employment was changed, you reduce their pay, it's going to be presumed again that you're retaliating. So you really, really have to have your T's crossed and your I's dotted. So the difference between paid family medical leave here in Massachusetts and FMLA, it applies to all Massachusetts employers with 1 or more employee, so everyone is covered. Employee eligibility, it's similar to unemployment, and the leave is greater than 12 weeks, which under family medical leave, it's only up to 12 weeks. The benefit year is different. There's broader coverage for family members, and the certification process happens by the Department of Family Medical Leave. So that's out of your hands. It's not something that you would be deciding. So it obviously is more generous, and it's paid where family medical leave is not. So what is similar is it does allow for intermittent leave. So I know I did a lot of intermittent leave with FMLA. It does allow for intermittent leave if the employer and the employee agree. And the employee still needs to give 30-day notice of an anticipated date, if that's possible, okay? Obviously some things are out of someone's control, but if somebody knows they're going to be giving birth, obviously they need to notify you at least 30 days in advance. So here's a checklist for you. You want to be reviewing your current policies, your leave policies, and obviously the mandatory state and federal leave laws. Look, if you have a short-term disability policy, you may want to, take a look at that to see if it would cover you, or you may want to talk to your benefits broker to explore, because there's time. You could just, is this something that I want to take on as an employer versus my employees, going through the state. That's your decision. They may be able to give you different options, different plans. And, determining what those costs are going to be, prior to July 1, and building a communication plan to employees, to comply with the posting and such, which again, TBD, we're going to get more on that. But those are the things that you're going to want to be thinking about. So I know it's a lot of information, and we will learn more, but I just want to open it up for questions or discussion. Yes. Sure. Yeah. Yeah. Absolutely.
My understanding is that our contributions are based on experience.
Yeah.
So in your scenario where you said the employer is not obligated to do any share family time, but some employers might opt to contribute more.
Oh, not more. They may, if they wanted to contribute what the employee, they could.
But why would they do that? Because it
Exactly.
might be funding something
Yeah.
not there.
Exactly. Yeah, I mean, I just know I've had people say, well, maybe, it's like, I don't know why you would, but you wanted to. Yeah. That's the same with the portion on the medical leave. I don't know. Some people are very generous, and they would, so. But you're right, it doesn't tie necessarily that, okay, I'm employer A, and I've contributed X number of dollars over the 2 years prior to somebody being able to use it. It's not like that pool is there for my employees. It's a pool that everybody is going to be, pulling from. So.
I had a question about that implied actually.
Mhm.
Do you know where they came up with that 0.63%? Because it seems to me that it's going to cost employers in the state a whole lot more than that. So within 2 years from now, won't they have to ratchet that percentage up quite a lot?
That's a good question, Tim. Yeah, it's I'm not sure actually where they got that 0.63%, but time will tell if that is going to be enough. Because again, just in conversations with folks that I've talked with, I do think that family side is going to be utilized, because if somebody previously would have been eligible to use FMLA and they needed to take care of a sick spouse or something like that, they weren't getting paid before. Now they're going to receive something. So I think again, time will tell. Yeah.
And with the benefits under the taxable income.
When they take it, you mean?
Yeah.
I'm assuming it'll be just like it would be for unemployment, right? Same kind of thing, because I would think so. Same rules. I'm assuming. Again, we'll learn more, but I'm assuming would apply. Yeah. Yes.
Mary Jane, a question regarding the certification process. Of course, we don't know what the state's going to do, but if it runs concurrent, if this runs concurrent with FMLA, we as an employer approve FMLA, we require our staff to use their benefited time. How long will it take the state to approve somebody under this new?
That is a question out there that is
That's
unclear.
another graph. I mean,
Correct. Right. That's another. Yes. Yeah. Yes, because you're right. Someone could be out, right? They have a 7-day waiting period. If the state doesn't determine for, another week or like how quickly, and what do you do about that time? Do you pay? Do you not pay? Do you?
Look how long it takes them to approve unemployment.
I know, right?
Yeah.
Yeah. But it's you're right. I mean, this is way more generous than FMLA. So it will trump it, right? You have to, whatever is most generous to the employee is what will occur. It would be curious though, if you were at FMLA, you're large enough to follow the FMLA rules, and the state denied them. But you
We said yes.
and you said yes. So that'll be interesting.
I think it would be worse the other way around.
Yeah, exactly, absolutely.
And I have another question, if you don't mind.
Sure.
In the original meeting, the split for the contribution,
Yes.
Was 50-50. Was 50 by the employer, 50% and of the 6.63, and then 50 by the employee. So this is now very different.
Yeah. This is what has been put out as what's even on their website. This is what is out there now.
So there's a stronger burden on the employer.
Right.
Not only do you have to give up the time,
Right.
you now have to pay more.
Right. And, you know, it's July 1st is not that far away, but I also have heard speculation that may get pushed out. So I've heard that, but I again, do not hold me to that. But, you know, I don't know. They,
Some sort of employee communication when they
right.
say, here's a new withholding
Yeah.
in your paycheck, but you don't get the benefit of it until a year and a half from now.
Right.
That's
And they may never, someone, and someone may never get the benefit of it, right? If they are never sick or they don't have a family member that's ever sick, it's just, yeah. They'll find a way. Yeah.
The mom now that's up to
Oh,
doing
absolutely.
you know, does not step up because I can't take the non-paid time.
Right.
Now they'll line up and say, oh,
Yeah.
6 months, you take 6 months, brother.
Yeah, absolutely. No, you're right. That's absolutely. Yeah, it'll, and I'm just curious if, to your point, Tim, if there will be enough money in the fund, you know, and what will, yeah.
Actually, I'm just thinking about, several people taking that leave for the same, if it's your parent who's sick and then you have your siblings taking leave for that period.
Right.
They've been away.
Right. I know you could be, if you're a small employer and you have, I mean, if you're under 25 people and 5 people happen to be out, that's huge. You may not be able to get the work done, so you'd have to hire somebody, bring them in, say somebody's out the 26 weeks. Their job's protected, but you've hired someone. That's too long to say it's a temporary job. You then have to offer them benefits. Then you're offering them COBRA. I mean, it is definitely going to be an interesting challenge.
Is it full protection for the 26 weeks?
It is.
And contribution to the health insurance?
Yeah. If they're, I mean, in some of these cases, if they're approved, right? Because I mean, if they're caring for a military, family member, that's 26 weeks. But the other, if I'm sick and then I have a child, then, it may not be, all in one full swoop,
12 weeks.
I know. Well, I know, again, I have worked for large employers, and when we would have somebody on family medical leave, we would hire someone for a 3-month period to cover, or we'd move somebody to cover their role and then hire someone else at a lower level, because depending on the level of the person, you may not be able to hire somebody to cover because they're at a higher level, and so you give people opportunity within your organization, and then it's good succession planning that I found, because then you're sort of training someone, and then you hire someone to fill in to do the other types of things that you could train someone easily to do.
That's fine for an office position, but for a caregiver.
Yes, right. Yeah, you'd have to have someone that is, yeah.
I got a question about the 7-day waiting period. So basically, does that mean if they take a 12-week leave, only 11 weeks are actually paid by the insurance the first week, they don't get any?
Correct. Right.
Exactly, the term.
And that, yeah. And again, you cannot require that they use any accrued leave. So, or, your vacation or, yes. Oh, sure.
I wonder if, we were talking about continuing the benefits, and, we have cost share arrangements where the employee pays a portion of the premium.
Right.
Now, when there are non-paid leave, we bill them their portion. I wonder if this will allow you, because they'll be non-paid technically on your payroll.
But that's the same with family medical leave, right? If somebody is on family medical leave, and if you didn't have a short-term disability plan, which you wouldn't be able to deduct anything from that anyway, you still have to figure out a way for them to pay their portion of, because you cannot deny that you can't stop their medical while they're on FMLA. So it's the same thing. They either have to pay into it, and again, we got burned in a company I worked with maybe once. So I veer on the side that people are honest for the most part, but when we had a population of many people were having children, which was wonderful, and it was easier for them to pay when they returned, and then we spread it out over a few weeks. And one person never returned, and even though we tried to get the money, we didn't, So I felt better about the way we did it, even though in one case we didn't get the money, you know what I mean? But so you could do it that way too, but I think it'll depend, on each situation, each company situation, as to whether they can do that or not. So.
Okay, I'm going to open the phone lines now. Anybody on the webinar, if you don't have a question, I would suggest you put your phone on mute so you don't get background noise. But if you do have a question, I will be opening that up in just a second here. Okay, so anybody on the webinar, if you have a question, you can answer it now. I guess no questions from the... Alternatively, if for some reason your audio isn't working, you can post questions. I guess we just unmuted. We're getting a lot of feedback. If you can mute your phone, please do so. Anybody have a question?
Muted.
Very cool.
Tim, there was a question on that was written out.
Okay.
Someone said, is the company required to continue to pay health insurance contribution, or can the company require the employee to pay the full amount after 12 weeks?
No, I mean, the way in which it states that they have to be able to be covered and pay their portion. So whatever they're currently paying, they would pay, which is different than, under other leaves like FMLA.
Any other questions?
Yes, in terms of what the documentation that the employer will be allowed to request when employees take family medical leave, how is that going to work? What kind of documentation can the employer ask for?
That, I think, that's going to be yet determined, but the fact is the employee is applying for this directly to the state. So they're not applying with you for the leave. So again, I think there's more to come, but I would hope that the state, just like they will notify you when somebody is collecting unemployment, that they will notify you that someone is on a leave. But that's still yet to be determined.
We have another question of, is the 25 employee limit based on FTEs or 25 individuals? I'm assuming that's full time.
You know what? I'm gonna verify that. I'm not 100% sure, because it's let me verify that. We can get back to you. There was a question in the room about if somebody did apply, they could go MIA. I think you still would want to have policies in place that if you're not at work, you need to communicate, that you're not at work, and whatever your communication process is, so that, because in a lot of organizations, 3 days no show, no call, you're terminated because you're like job abandonment. But I think that shouldn't change. They still have to notify you. if you're a company that isn't 50 FT, you don't have 50 employees, because for FMLA, the number is 50 employees. It's not FTEs. It's actually 50. Now, you may have to offer FMLA in your company, but if the person applying for it isn't, qualified and hasn't worked that 1,250 hours, they may not be eligible, even though you have to have it available, that type of thing. So, yeah, it may make sense to have that if you are in that FMLA category. Yeah, I know, and hopefully we'll get more regulations on what the employer can and can't do in regards to that. Because again, you don't want to be deemed as being retaliatory, but you need to also know if somebody's good. If a healthcare provider needs to be, going to someone's home and they're not showing up, then you need to get somebody else there, and you need to know that they're not going to be available. So yeah.
There's got to be accountability somewhere.
Yes, absolutely. So.
One other little tidbit that I wanted to share. I talked with Mike Oberlander from Perryville Marketing Insurance, who handles our short-term disability plan for our employees, and asked him how this will affect short-term disability and why would we even want to continue to offer that. And he said, that's a good question. He was going to be going to a conference where that was going to be discussed, I guess like next week or so. And he would let me know, but it does seem like this is very duplicative of what anybody would be currently offering as short-term disability.
Well, and the other thing too, like any short-term disability plan, right? Someone can't earn more than 100% of their pay, so you can't double dip. And how is that gonna, because I probably you all have had this situation too, where someone is able to collect short-term disability because they can't work full-time, but they can work a portion, they're on light duty or something that they can get back to work, but they can't earn more than 100% of their pay. So they can't work, if they work more, then their short-term disability gets reduced, So all those things are, Tim, are definitely going to be.
Well, it'd be an opportunity to switch to a voluntary plan.
Yeah.
Short-term disability, because in that regard, they can double dip. Because they're paying for it themselves. But if it's a company-sponsored plan.
Right.
Then it makes no sense to pay both.
Right.
From an employer perspective.
Right. Yeah. Yeah. What other questions?
Take us to the kickoff here to figure this all out.
I know, right? Absolutely. Well, and there's there definitely needs to be more information even before July so that people can figure out. I know even at our company we're working on solutions in which to help employers and making those deductions, and then we don't have all the details yet from the state as to how that's supposed to be done and that type of thing as far as remitting the amounts and stuff. So, I mean, there is more information that's needed, but that's something that you want to be sure that, with your companies or your payroll providers, you're working with them on that, as well. So, what other questions? Yes.
I still had a question about that benefit year.
Yes.
Thinking, in the scenario you provided, someone went out on March 17th for a childbirth.
Yep.
And then maybe, the next January, we're still in that 12-month clock, they have something, they fracture their ankle or something completely different.
Yeah.
But if their clock is still set at March 17th, because,
all right.
it's two different
Correct.
things.
Right. Yeah.
So is that March 17th, when do they get off that clock and start a new clock? Is a whole 12-month period without a leave have to?
So, no, I mean, so the clock, so the question was, if someone went out this week on a maternity leave, say, and then was out for 12 weeks. Then in January fractured their ankle. They had returned from the maternity leave, but fractured their ankle and couldn't work. They could be approved for additional time. So in that benefit year, if their benefit year started March 17th until next March 16th, they can only use a total of 26 weeks. But it's that's their 52 weeks. 52 weeks is from there to there. And the way it's written, potentially, they broke their ankle in January, then in August of that year, their spouse is, comes down with cancer, and they have to take him to, every Friday for chemo. That could be time that they apply for again, because then the time would start from the time of the leave, So it's,
And that goes to, in terms of intermittent, and I know the place you said it's just for bonding, because I'm wondering, in terms of the intermittent leave, then if say, and you've used a good example, if it's every Friday you need to
right.
do this, then how is that calculated? Is it like prorated on the weekly benefit?
Can't get to the slide. So in that,
Okay, so I misspoke.
So I misspoke. The intermittent leave is for bonding that can be used under, but under FMLA you could have intermittent leave, for other things than bonding with a child. You can have intermittent leave.
And I know we have employees who probably either their child has some certain illness where
right.
they need to go, every 2 weeks.
Yes. Yeah.
But because it's unsafe, then it's just making sure that the time is well communicated.
Exactly. Absolutely.
But how would the waiting period apply then? The 7-day waiting period?
If it were intermittent?
Yeah.
Well, in the case of a bonding with the child, more than likely, if you gave birth to the child,
right.
You'd be out because of that. So you'd have that 7-day waiting period. If you were adopting a child, again, I would presume that you would be with the child at least for 7 days before you returned.
What if, for example, you had to go in for dialysis every Friday?
Mm-hmm.
You need to be out every Friday.
Right.
Well, there's never a 7-day period that you would be out the whole 7 days. So either would that, or would the 7-day waiting period start from the first Friday that you went out, the subsequent Friday?
I think I don't know how, I'm not sure, Tim. I think we'll have to learn more as to how that, and if that will be covered, So, yeah. What other questions? All right. Well, thank you all for your time, and there will be more to come. Oh, you're welcome.
For those of